Social determinants of health are key in patients' overall well-being. Up to 70, 80% of the patient's overall well-being has to do with things like social status, your economic status, your access to food, to transportation, your social support, right? Are you in a relationship? Do you have family? Do you live alone? These social determinants of health impact a patient's ability to do well. If you are a patient who has financial insecurities and you can't afford your copay, do you choose to use the $40 for a copay to visit the doctor, or do you choose to use those $40 to provide food? If we don't provide intervention for patients' social needs, what we do see is patients continue to return to the hospital.
Many times we identify that they're there because they could not afford the medication, and then therefore they go to the emergency room. Why? Because they know that they can go to the hospital to get a blood pressure pill, or they can go and get insulin, which they could not afford at home. Memorial Healthcare System has 8 primary care centers that are strategically placed throughout the South Broward District. There's a charity program that allows individuals that live in the South Broward Hospital District to be able to receive primary care and address all their preventative measures as well as manage their chronic care conditions. And that is truly what population health is all about.
And so what we do at Memorials, we identify when a patient has a social need, and we provide interventions for that.
Hi, darling. How are you?
Once the patient is identified as having a need, the health coach or our social worker will meet with the individual, whether it be in the office during their primary care visit, or we can deploy and go out into the home. She takes an assessment of the home, whether it be looking in their cabinets to see if there's food, looking in the refrigerator.
So you need some vegetables, fruits. Right. It's been hard because, between moving and buying things in the supermarket, and, it's been a lot of hassle, really.
Angela is a mother, and she's an advocate for her son. Her son has a cognitive development delay, and Angela has been trying to get him Social Security for the last about 5-6 years. So I've been on this journey with Juan and his mother for 3 years now.
Have you been in touch with his disability attorney?
First off, we applied for Medicaid. He got denied. I reapplied 2 times. On the 3rd time, he got approved. Then his Social Security was approved. Then I applied to him for a TOPS transportation, Broward County Paratransit, and he was approved for that. And then with the Medicaid, he was approved also for food stamps.
Thank you for
You're welcome. More than that.
She's enabled to help me, give me encouragement, tell me don't give up,
We're here for you.
keep on going. And I really appreciate all the help that she has given me, and especially for my son.
The ultimate goal is to reduce symptoms and get them to a state where they have a positive overall state in their home.
When I think about this program and I think about population health and the work that we are doing as an organization, it fills my heart with joy. I was once on assistance from the government, so I understand and I really have a respect for the individuals who don't know how to find these resources. I want to make a change in one's life because there were people that were there for me when I did not have.